partners, Dr. Mabudi and Dr. Melrose, who are standing back there, are going to be participating with us in the seminar tonight, and we're lucky enough to have Joe and Jack come and be here tonight, and I think they're going to talk to you for a couple minutes. We've been doing these seminars now for almost a little over 10 years, and as a result, we kind of know what it is that you're interested in. We also, all of us that are eligible, are former patients who've had the laser surgery done ourselves, and so we kind of understand from a personal aspect about what we thought was important, what we wanted to find out before we had our own treatment done. And so we'll try to address those issues. If we start answering questions during the presentation seminar, though, it really bogs down and we'll never really get through the things that we think you want and need to hear. But I promise that before we're through tonight, we will answer all the questions. If you have a burning, come on, well, if you have a burning question you just can't stand not to ask, please jot it down, and I promise at the end we will stick around and answer questions. Some of you have a question you want to ask, but you don't want to ask it in front of the group, and that's fine. The three doctors will stick around at the end, and I heard Joe on the radio this morning claiming that he's going to answer all the questions today, so we'll see if that's true. And it's actually going to do Kevin's surgery, if Kevin will let him. We're not sure if Kevin will. Anyway, we'll stick around and answer individual questions afterwards. It's interesting to do seminars nowadays because seminars for patients nowadays are different than they used to be. In the early days, nobody knew anything about this, so it was very easy to start at basically with no knowledge base and build from there. But some of you are very well educated, and our preference is that you become as well educated about laser vision correction as possible before you really seriously consider having your eyes done. You need to know as much as you can. You really only get two eyes, okay? There is no drawer full of spare parts. It's not like buying a big screen TV. You can't take it back if you don't like the picture, okay? And so you really need to understand this well and understand whether or not this is something you want to pursue. If after what we get through tonight we've reached a point where you can make a decision about whether or not you really want to find out if you're a candidate for this or not, then we've done what we should. We've given you enough information to make that decision. Some of you have been to other seminars, some of you have done a lot of internet research, and some of you know a lot about laser vision correction. We'll try not to bore those of you that are in that situation. There are some of you that don't know anything, and you're starting out with no knowledge, and we'll try not to overwhelm you as well, okay? It really is important that you understand how your eye works, and so the first thing I'm going to attempt to do is to talk to you a little bit about how your eye works and how your eyes work together to give you vision, and then from there explain a little bit about how excimer laser technology developed and how it can correct vision, okay?